Mr. Smith.
Thank you, Mr. Chairman. Thank you, Secretary, for sharing your time here today. I'd like to start off with an issue that I've worked on for quite a while now, and that's TANF reform. I think there is ample opportunity to get some things done here. A while back, introduced Jobs for Success Act in the previous Congress, and to really focus on helping folks who need the most help, who are very needy, that in fact the neediest among us. One of the most important provisions of that bill, I will say, is that it would prohibit the use of TANF funds for families with income greater than twice the poverty line, so 200% of federal poverty. I'm pleased to see the priority was reflected as a key proposal in the Administration for Children and Families' recent proposed rulemaking on strengthening TANF as a safety net and work program. In fact, the very first proposal included in that proposed rule is to establish a ceiling on the term of needy so that it may not exceed a family income of 200% of the federal poverty guidelines. So I certainly appreciate that ACF recognizes this issue. So setting aside other issues of TANF, I'm wondering where I think there could be some other things that we would disagree on, but I'm just wondering if when it comes to establishing this ceiling of 200% of federal poverty, could you support the legislation? I've introduced the legislation already. Could you support that as a standalone measure?
Congressman, first, thanks for the work you're doing on this, because it is not easy. It will take congressional action to get reforms to TANF that will get it to work better, to do, as you said, to concentrate the money on the most needy families. We, as you mentioned in our proposed rule, look to try to do that as well, but we are absolutely prepared to work with you to see how we can do it, because if it's in a statute versus a regulation, far more powerful.
Okay, so I'll take that as a yes.
We'll work with you, because our own proposed rule is right now undergoing a lot of comment as well. So we're trying to take in comment to figure out where best to go. But without a doubt, you all will be indispensable making sure we can get TANF moving in a better direction.
Okay, thank you. Earlier this week, I'm glad our committee held a hearing in Texas to discuss problems that our constituents encounter in accessing emergency care. I'm glad to say that a critical access hospital, formerly critical access hospital in my district, Friend, Nebraska, previously having been critical access, shifted into the rural emergency health facility, and that was rocky. That transition was rocky. There's concerns that it didn't need to be that way, obviously, but wanting more information at the local level, they tried to get that information. It was not available. I think it took some 4 months for this institution, that was facing budgetary problems, to shift gears into this new category so that they could help their own patients. And so I'm just wondering, fortunately they had local government to help back them up, but not every facility would have that. So I know that this rural emergency healthcare designation is very new, but I'm wondering what HHS can do to make the process faster and even more transparent. And could there be a dashboard to allow the local level to pursue the status of where they stand at a given point in time so that they can get this done more quickly?
Yeah, and Congressman, you bring up a very important point in that this new classification will be very important for a number of these facilities. We want to make sure we do it right, because, as you know, there's always an effort when there's money involved to game the system, and we have to make sure it's done right, so we reserve the category for those who truly qualify. I think with time, we're going to start to really get a better sense of how to move this faster for those who wish to qualify. But the best thing I can tell you is that we're going to do everything we can to sustain some of these hospitals and facilities in rural America, because if they go, there's nothing to replace them.
Okay, thank you. And just briefly here, I'm concerned that despite ongoing attention to the Office of Refugee Resettlement's losing track of thousands of unaccompanied minors, I'm just wondering, do you truly believe that ORR is doing everything possible, especially when it appears that we've lost contact with nearly 20% of children released through the Unaccompanied Children program?
Congressman, thank you for posing the question. And respectfully, I'm going to correct what you said. We haven't lost any child. Please remember that our jurisdiction that you all gave us, that Congress gave us, is for custody of children. Once we find a vetted sponsor, which we're obligated by law to do for these migrant kids, we lose all jurisdiction over them. We don't have the ability to follow up with them or require them to follow up with us. So it's hard to lose anybody you don't have jurisdiction over.
Okay.
What we do try to do is voluntarily keep tabs of them as we transfer them out to a sponsor. But
everything's
while they're in our
okay?
care, they do not get lost.
Everything is working fine. Is that your suggestion?
In our jurisdiction, the custody that we have of kids, I welcome you to come and take a look. We are taking care of these kids. Now, what happens to a child once they're into the community and they get attracted to get a job at some, meat packing plant? I wish I could tell you, I could speak to that. Until you all give us jurisdiction to oversee some of that, I can't go there.
Well, last March, a year ago, I wrote a letter, got a response in July. I had to follow up in October and still haven't heard. So I'm concerned that there's problems. So I hope we can work together to establish a better system. Thank you. I yield back.